We're back with Dr. Elizabeth Altizer to break down what each type of provider can do. Can we just start with maybe the basics of providers, like what is the role of the OBGYN? What's the role of my primary care physician, known as a PCP? Can midwives and doulas do some of these things?
In training, primary care physicians are also trained to do breast exams, pelvic exams, pap smears. Now, not everybody's primary care physician continues to do breast exams and pelvic exams, but that's definitely a conversation to have with your primary care physician. There are a good number of primary care physicians that are doing breast exams and pap smears as a part of your annual exam with them. And that's also a good way for a lot of people to get all of their annual exam done in one visit instead of multiple visits.
Convenience.
Yeah.
At least we're getting it done.
Right. There are also a lot of primary care physicians that will prescribe birth control methods, place Nexplanons.
Oh, great.
Talk to you about pills, patches, rings. From my experience, not really a lot of primary care physicians are placing IUDs, but certainly there are certain primary care physicians that are trained in that as well. Nurse practitioners and physician's assistants that work in these offices can also be trained in placing Nexplanons, IUDs, talking about family planning. Typically, though, I'll see patients who maybe they get their annual exam with their primary care physician, but the birth control pill they're on isn't working and they want to talk about different options. Since we're getting a little bit more detailed into birth control, a lot of primary care physicians are then just sending you to see a gynecologist. A lot of OBGYNs are both obstetrician gynecologists, meaning that me as an OBGYN, I deliver babies, but also take care of women through perimenopause and menopause, do procedures to deal with bleeding, sterilization, hysterectomies. Not all OBGYNs are doing both of those things. Some people are just delivering babies. Sure. Some people are just doing gynecologic procedures. But it is important to have those conversations to see if you have a provider that's meeting those needs.
You brought up pap smears and pelvic exams. What is the difference? Is there a difference in the two of those?
Yeah, so actually the pap smear guidelines have changed as far as back in the historic past, people were recommended to get pap smears every single year. What that is it is a swab of the cervix, the opening of the uterus, and it's a screening test for cervix cancer.
Okay.
Now, pap smears are tested if you're over the age of 30, usually routinely for also the HPV virus. Human papillomavirus, which is the cause of abnormal pap smears and ultimately cervix cancer. If you have a normal pap smear and a negative HPV result, you don't necessarily need a swab of your cervix every year. However, it's still recommended for you to have a pelvic exam every year where the speculum is used to open the walls of the vagina to look at the cervix. And then typically an exam following that where someone feels your uterus and feels over where the ovaries are located to make sure that no abnormalities are found. That's usually recommended once a year, as well as a breast exam. Once you're 40, you're recommended to get mammograms yearly.
And I know that you and I have talked about this off of camera, and that was kind of the build-up to that first annual exam. We get so nervous about it because the speculum is going to open us up and it's going to be so uncomfortable. I know that it was a big deal to wait until I was 18 to do this because my pediatrician was doing things before that. Is there a area for adolescents to see a gynecologist?
As far as talking about your menstrual cycle and menstrual regulation and birth control, I usually vote the earlier the better. And a lot of gynecologic offices will see patients starting at age 13. For younger than 13, typically you're talking to an adolescent gynecologist or just your pediatrician about those things. But in general, you don't need to have an intimate exam, as they're called, breast exam, pelvic exam, really until age 21, unless you're having issues. You're having difficulty with tampon placements, you're having discharge, itching, pain, then obviously an exam would be warranted in those kind of situations. If you don't have any problems and you're just wanting to take a birth control pill, you don't typically need to have a full intimate exam just to talk about birth control.
Can you explain the role that midwives and doulas play for midwives outside of pregnancy and for doulas during pregnancy?
Doulas traditionally are birth coaches.
Okay.
They are a primary support person for the woman that's in labor to not only help them with like pain management strategies, but also like an emotional support. There are a lot of doulas that also help postpartum with breastfeeding and mental health.
The absolute roller coaster that is postpartum.
Not everyone's created equal, so there are going to be doulas that are ready to stick with you through your delivery and postpartum, and some that probably specialize with just your delivery. Then when you get into midwives, there's a range of training. Some people are certified nurse midwives, CNMs. They have a nurse practitioner degree and are a midwife. So they also are seeing patients in the clinic and are trained in doing pelvic exams, breast exams, pap smears, those kind of care, as well as doing your prenatal care and your delivery. But if you are not a certified nurse midwife and you did a different type of training, maybe you're specializing in specifically prenatal care and delivering babies, and maybe you're focusing less on gynecologic exams with breast exams, pap smears.
Thanks so much for the information, Liz. I think that when we have the knowledge, we then have the confidence to make our own reproductive health care decisions.